to start off with some myofascial techniques. We're going to focus on the biceps and the forearm today. So first you want to get whatever medium you have around. In my case, I just have a little bit of cream. And then you always want to start with effleurage strokes. And I'm going to use my shoulder to my advantage. I apologize for my terrible posture. My chair is really tall. So we're going to start with some effleurage, just introduce our hands to the body, get them used to us before we go in with some of the deeper and more aggressive massage techniques. And then from here, you can also use your leg to help relax the bicep, just so that way it's not on length. You do kneading as well, helping pick up that bicep muscle belly to really make sure all of it is incorporated into your massage stroke. You can also use these lighter strokes to kind of assess and find problem areas. So especially along the lateral side, right in here, I can see a lot of tension. So I'll just do some longitudinal strokes, getting a little bit deeper to not only assess where we might have some trigger points, but also start to relax them. So you can do bending just as a greater, deeper stroke, or this can be a rhythmic activity as well to kind of facilitate that muscle relaxation. And you kind of go based on how the patient is relaxing. From there, we can do C strokes. We're stabilizing with one hand and then creating a C shape motion. And then you can also go in with J strokes. So then from here, we have the forearm. Same thing as before. So I'll fast forward and do that part fast. So for patients with lateral epicondylgia, if I can ever say that right, or pronator teres syndrome, working on a supinated forearm can especially be useful. Working especially on the pronator teres, doing some deep pressures following the fibers of the muscle belly can also be helpful in kind of turning off that pronator teres. Pronator teres syndrome, pronator teres is hypertrophy causing compression of a peripheral nerve. So this can be a way to help facilitate that. You can also go cross friction as well, fast or slow. And again, here we can also do a C stroke across or do some J strokes right at that common extensor tendon insertion at the lateral epicondyle. Since he has a lot of tension there, that is calling the name. With our patient in prone, we're going to do a little bit of myofascial work on his triceps. So if you get a little bit of whatever lubricant you happen to have around, whether it's a cream or an oil, you can start with some effleurage strokes, just to introduce your hand to a new area since we're on the back of the arm now. And with that muscle relaxed, you can go into that deep pressure strokes. Do some kneading as need be. And also bend like we were doing on the biceps. We're pulling that muscle to the side. This can also be a rhythmic way to kind of get the triceps to turn off as well. You can just do long, deeper strokes to kind of bend that tricep away. In addition to that, I feel some tightness right on the borders of his tricep on the lateral side. So I'm going to do some C strokes. We're stabilizing with one hand and doing literally a C shape with your bottom hand. So we're going to do some neurological interventions today. We're going to focus on the radial nerve. So first we're going to do a tension technique, typically used for diagnostics. So we're going to start with elbow extension, and then forearm pronation and shoulder internal rotation. Then at the wrist, I don't know if you can see this in the camera, we're going to do wrist flexion and ulnar deviation. As you hold that position, you're going to slowly bring the arm out into abduction until symptoms are provoked. I saw a face. How you feeling?
Good. So good.
Where do you feel it?
Middle of my arm.
Okay. So then from here we're going to go into a glide technique. So I'm going to have you bend your head to the left and to the right. So we're going to start with your head to the right. Perfect. And then to the left and to the right. To the left and to the right. So this, as I'm doing this, hold on one second. I'm going to adjust the camera. Realize you couldn't see what I was doing. So I'm going to do wrist flexion and extension as he moves his head. So as the wrist is in flexion, he's moving tension. He's releasing the tension on that side. So it's a flossing technique. So as one goes under tension, the other is releasing tension, and then vice versa. So that way, the nerve is being mobilized back and forth. So there's not tension on both ends. There's tension on one end and release on the other, and then back and forth. For the nerve glide techniques, you want to shoot for 5 to 10 repetitions, and you want to try to go at a fast and rhythmic pace to prevent the stress strain curve from moving to the right and having the arm fight against you. So next we're going to do some mobilization with movement techniques to address elbow mobility issues. So we're going to start with elbow flexion. And to facilitate these mobilization with movement techniques, you can either use a towel, or in my case, I actually rolled up some sheets just because it gave me a little bit more of a sturdy platform to go off of. So if you put the rolled up towel in between their arm about where they have their flexion limitation, so for him, it's about here. And then since my table is pretty soft, I'm going to also use my hand underneath the humerus to support so I can make sure I really get the force that I need. So I'm basically using this as a pivot point to create additional forces needed to get that osteokinematic and arthrokinematic motion to increase elbow flexion. So if I can get the camera right, I'm going to apply a force through the ulna and the radius, using my towel as a pivot point and stabilizing the humerus in order to increase elbow flexion through osteokinematic and arthrokinematic movements. So here we can do the same thing to increase elbow extension by putting the towel underneath and doing the same thing. Obviously his elbow extension is intact, but if, say, he was limited to here, you can use that towel to your advantage. So I'm going to use my knee just to speak hypothetically. You could do the same thing to increase that elbow extension, either going close to the joint, or if you need more torque, going farther away from the joint. And then from here, you can do pronation as well. For pronation, you can use some form of... So for mobilization with movement techniques to increase elbow pronation and supination, things get a little interesting since you can't really use that towel as a pivot point. Instead, what you can use, if you get a little creative, is something with a longer lever arm with ideally some weight at the end. So you can use something like a hammer, or in my case, I happen to have some bottles sitting around with some weight at the end. So we're going to have our patient hold the bottle at the end and perform pronation and supination while we're doing those glide techniques that we discussed in the examination video earlier. So You're gonna hold it at the end. Nice good grip on it. And then we're gonna start with that motion. So we're gonna start palm to the sky. Relax your arm on me. You're just turning this way. And then back. So turn over. Nice and slow. As you turn over, you're doing a medial glide. So as patient pronates, using that medial glide at the radial head. You can also stabilize the ulna better as well. Beautiful. Go all the way. Palm to the floor if you can. Beautiful. Beautiful. And then you can do a lateral glide as he comes back into supination to assist in getting full supination. Beautiful. Come all the way again. All the way, palm to the sky. Beautiful. Next, we have some stretching interventions. So for mobilization with movement techniques to increase elbow pronation and supination, things get a little interesting since you can't really use that towel as a pivot point. Instead, what you can use, if you get a little creative, is something with a longer lever arm with ideally some weight at the end. So you can use something like a hammer, or in my case, I happen to have some bottles sitting around with some weight at the end. So we're going to have our patient hold the bottle at the end and perform pronation and supination while we're doing those glide techniques that we discussed in the examination video earlier. So, I'm going to hold it at the end. Nice good grip on it. And then we're going to start with that motion. So we're going to start palm to the sky. Relax your arm on me. You're just turning this way. And then back. So turn over. Nice and slow. As you turn over, you're doing a medial glide. So as patient pronates, using that medial glide at the radial head. You can also stabilize the ulna better as well. Beautiful. Go all the way. Palm to the floor if you can. Beautiful. Beautiful. And then you can do a lateral glide as he comes back into supination to assist in getting full supination. Beautiful. Come all the way again. All the way, palm to the sky. Beautiful. Next, we're going to move on to some muscle strengthening exercises. So we're going to start with what I call the triceps pull down. So for this one, you're going to have a TheraBand and a door frame. And then depending on where the patient grabs the TheraBand, depends on how much the intensity is for the exercise. So we're going to have our patient with level shoulders with their elbow at their sides, and they're going to bring the wrist down towards the ground and then slow on the way back up. So we're emphasizing the eccentric contraction here. So normal speed on the way down and then slow on the way back up. As far as parameters for these exercises, the ACSM for strengthening recommends 8 to 12 reps and 2 to 4 sets with anywhere from 30 seconds to a minute in between sets. But depending on the motion that you're doing, you could also have endurance parameters as well. So that's enough for triceps extension. You get the idea. The next exercise we're going to do is also involving the door. We're going to take out the TheraBand. We're actually going to use the doorknob. So if you want to stay on that side of the doorknob, that's actually perfect. So you can use a door frame like this. And what I'm going to do is resist supination and pronation. So we're actually playing tug of war right now. And I can either let him win or I can win. He's not going to let me win. So let me win a little bit. There you go. And we're practicing supination and pronation. Now if he gets into a little bit of a squat, he can try that supination and pronation with his elbow more at 90. Now these you would want to do over and over again. Now say if we have a profession like a mechanic that's constantly turning a screwdriver, this exercise could mimic that of a screwdriver with the resistance from, say, the wood. So in this case, you could be using more of endurance parameters like the ACSM recommends, which is 15 to 20 repetitions for 2 to 4 sets, and then about 30 seconds or less of rest to really get that muscle working for a longer period of time for endurance. Last but not least, we're going to do some coordination and functional retraining exercises. So we talked about our patient being a mechanic earlier. So we're going to work in quadruped as if they're crawling in small spaces. We're working towards the bottom of a car. They might need to be in this quadruped position and using one arm to manipulate, say, a screwdriver or something like that. So we're going to have our patient in quadruped. We're going to try to facilitate a flat back as much as possible. And then we can do one of two things. We can have them bring one arm up like this and provide external perturbations at the hips and the shoulders to see about that dynamic stability of the arm that is straight, just like we would do for any other perturbation exercises here. Additionally, we could also have them doing something with that spare arm, such as like reaching out and giving me a high five at different areas, just facilitating that dynamic stability of that stance arm. From here, we can have the patient sitting on the side of the bed. Beautiful. And then we're going to go back to that pronation and supination from before, but what we've done to change the equation is I've added some water in the bottle, so that way as the bottle moves, the weight within the bottle actually changes. So we're going to do the same pronation and supination from before with our elbow now at our side, and you're just going to turn all the way over and all the way back. And you can either do this slowly or quickly based on their abilities, and you can also vary the amount of water that's in the bottle, or you can make it heavier, do something like sand, rocks. So as the water moves, it's creating a perturbation moment at the wrist and the elbow as well. So that's this one. As far as parameters are concerned, it really depends on the difficulty of the activity, but ideally we want this to functionally root and stay put for a while. So if the patient fatigues, then we can do more than one set. Otherwise, so we could do like, say, 2 sets of 10, or we could just go straight through and do like 20 repetitions. For something like this, it's pretty easy and the patient's not fatiguing with it, so we could just do 20 repetitions from there.